Welcome back to our Valley Wellness Podcast. We're excited to talk about today's topic. It's maybe a little uncomfortable for some people to talk about. It is something I get tons of questions about, so I'm excited to talk about it. Before we begin, I just want to reintroduce our panel here today. We've got Jen Krebs. If you want to just talk about yourself for a second.
Yeah, so my name is Jennifer Krebs. I am a certified nurse midwife, advanced practice nurse. I'm practicing for 15 years in this area in women's health, gynecology, obstetrics, and primary care.
Okay.
Passionate about optimizing health.
Yes, and all aspects of women's health. And Tennille, go ahead.
Tennille Cloward. I am a board certified OBGYN, also clearly as an OBGYN with a focus in women's health. With a passion about optimizing their wellness and longevity.
Yeah, and I'm Sean Haskett. I'm an OBGYN as well, practicing for 17 years, specializing in women's healthcare, and very passionate about changing the paradigm around women's healthcare and helping improve the quality of life. Just wanted to introduce this topic today. It's probably one that I get questions about often when I'm taking care of patients. And it is hard to answer in the short amount of time that we have as providers. And so I think it's something that will be great to be able to talk about a little bit greater depth, and hopefully answer some questions that people have, see what's out there, and then hopefully direct you to a place where you can get more help and help improve the quality of your life in this area. So we're going to talk about sexual dysfunction. And this is, I think we live in a culture that's starting to open up a little bit more about it. I definitely feel like patients are starting to ask more questions about it. There's more information out there. Some of it's good, some of it's not very good. And so I think we want to do a good job of helping people know what's out there, what is helpful and can make life a little bit better. I think probably the question I get most often is, a patient comes in and says, hey, I have a good relationship with my partner, but I just have no libido. Like I just have lost interest in having sex with my partner. Is there something wrong with me? Is there a way to fix that?
I feel like this is a question that when I'm asked, I'm actually grateful. I feel like my patient trusts me because this is a hard question.
Isn't that flattering?
It is flattering.
They trust you enough to bring it up.
Because it's a very personal question. It's a very hard question to ask, but it's a very important question to ask. And first and foremost for me, it's important for me to let her know, guess what? 50% of women who are peri and postmenopausal especially are going to have some level of sexual dysfunction, meaning that they're unsatisfied with something. But it's not an easy question to answer. Is there something wrong with me? Because the reality is sexual dysfunction includes so many different areas. There are things that are mental, there are things that are physical, there are things that are social and cultural that are going to affect your level of satisfaction with your sexual life. Would you agree?
Yeah, I totally agree. And I think, once we define it as a problem, the definition of a problem depends on the individual. It is dysfunctional when it starts to disrupt your personal life and your relationships. And for a lot of women, that's only having sex once a month or once a year. And for a lot of women, they wish they were having sex 5 times a week. So what is defined as a problem depends on the individual, their relationship, and their expectations. The other thing I really like to define with women is the difference between desire and pleasure. There's a difference between wanting sex all the time, and what is normal for that varies widely depending on the individual and depending on the expectations that she and her partner has for their relationship, and the difference between that and actually enjoying sex when you have it. So I like to first remind women that they are not broken. That's, I think, the most important thing that we need to emphasize. Wherever you're at, everybody's been there. You are not broken. Just because you're not thinking about sex all the time doesn't mean that there is something wrong with you. It means we can talk about some different things. And as long as you still enjoy sex when you have it, we've got a lot to work with. So, just the desire for sex is something that varies on, depending on where you are in your lifespan. It varies depending on your stress levels, the amount of sleep that you're getting, the quality of your relationship, your physical health, and whether or not you have a chronic illness. There's a lot of things that influence that. Whatever it is, you're not broken. If you still enjoy sex, oh man, we have a lot of places that we can go and that we can work with.
Yeah. And this is another, I think, area where it's just not generalizable. Like everyone isn't in the same box. Like I get women in their 20s who ask about sexual libido, and I get women who are in menopause, and I get women who are transitioning to menopause. And so it is something that can impact you at different times in your life. And there are various reasons why it's happening. And so I think kind of having the conversation is super important to being able to help this get better. And there are multiple factors. Sometimes it is medication that can be helpful. Sometimes it is a lifestyle change that can be helpful. Sometimes it's some counseling. Like there's lots of different ways that I think we can help improve this area of life. So let's talk about some of the more specifics. So, I mean, I guess a question I get often is, hey, I don't want to go on medicine. Is there anything non-medical I can do to help improve my libido?
There definitely are non-medical things that can be done. They're not easy,
Right.
and this is one of the things that it speaks to their level of commitment, the fact that they're asking. But I think non-medical options are, for the most part, going to be some sort of counseling. Because you've got to learn to work with your partner. You've got to learn to communicate with your partner. You've got to be able to relax, let the outside world stay outside the bedroom. And as a sex therapist is someone that is very equipped at helping you kind of go through those different areas to maximize your sexual relationship with your partner.
Yeah. Yeah, I agree. I think there's a few little things that we can work on clinically. I hear it really commonly in couples that have been together, usually for around 2 to 3 years. Usually around that 2 to 3 year mark, they say, I mean, I've been married for 2 years. I've been with my partner for 2 years. It has never been a problem before. And I think, I think I know something about what might be happening. It's possible you're getting a little bit lazy in the way that you interact with each other. The time that you spend together is different. The amount of non-sexual physical touch that's happening. I tell women, women are ovens and men are microwaves. Like it's really easy for a man to be turned on and to be aroused. Arousal for a woman happens a little bit differently. It happens, it's a gradual process. It's an everyday process. It has to do with the way her partner touches her without expectations for sex. That is just because she is beautiful and she is wonderful and they love spending time together. And the amount of foreplay that they engage in starts to change right around that time in a relationship. There's a lot less physical stimulation. There's a lot less making out. It's kind of like, oh, we have a second, let's get to this. And it's a little bit harder for women to want that.
And that's probably also when the first baby arrives.
That's what I was going to say.
Man.
It feels like this question comes after the first baby.
The number of times I have a woman. Go ahead.
She's listening. She's trying to hear the baby crying while she's trying to get it on with her husband.
Yes.
Yeah.
And she's had 3 hours of
challenging.
sleep. And
Yeah,
for sure.
Yeah, sleep deprivation, all of that. Yeah.
And I think a big part of that is communication between partners. And, one thing that can happen is when things aren't quite where they want it to be between partners, one has a different expectation than the other. There can be some resentment or some hurt feelings. And most of the time, it's not as personal as it feels to each other. Being able to have conversations with your partner, I think, make a big impact. And not having it, it's hard. It is very hard, and there are a lot of emotions. So if you can pull some of that emotion out and just be like, "Here's what's going on. Here's what I feel," it does. I feel like sometimes help bridge the gap of what is missing, what is not working well.
And I think culturally we do this really cruel thing to both men and women, where there's this expectation that women are going to have the same amount of desire as men, and they feel broken if they don't.
Right.
And men feel like somehow they're not desirable enough if she's not meeting their meeting the expectation for the amount of desire. So then there's this overwhelming sense of inadequacy on both parts, and it's really hard to overcome that.
But at the end of the day, you have to sit down together. You have to realize that you have a common goal.
Mm-hmm.
You have to trust each other. You have to be able to open up and have that hard conversation where you're both open and honest about what you need and what you want. Realizing that you do love each other and that you both want the same thing.
And maybe, there's a new baby and we don't get to go out on dates as much. We don't get as much quality time together. Your job's gotten really stressful.
Or you might have to schedule things a little more than the spontaneous when you're first newly married and you don't have
there ain't nothing wrong with scheduling sex.
Exactly. So I think that's normal.
In fact, if you use it as a way to build up to the excitement over it.
It can be super helpful.
Yeah.
Well, and I think it can be a problem when people compare, like maybe when they first met, and things can be a little more hormonal, I feel like, almost at that level, and not necessarily always reality when you first met compared to when you've been together for 3 or 4 years and you have a lot more responsibilities together. And so I feel like sometimes it's a little bit like a muscle. Like you have to do some things to work and make things better, whether it's your relationship, whether it's planning it, whether it's planning dates, whether it's communicating. Like those type of proactive strategies, I think, are super helpful.
It has to be priority.
Yeah.
Because bottom line, it's central. It is key to the relationship and the health of the relationship.
And relationships are one of the core principles in health, right?
Yeah.
I talk to my patients about the five pillars: nutrition, exercise, sleep, stress, and relationships. The reality is we are social creatures. A lot of our physical and mental health depends on the quality of those relationships. So when we prioritize them and we make it a point to sit down and maybe have some uncomfortable conversations and talk about solutions, a lot of those things tend to work themselves out.
Yeah, I agree. I do also feel like there are, outside of counseling, like some things do help improve your overall quality of health that actually also help improve your libido. Getting enough sleep, that's a really important one, and that's not always easy when you have a newborn baby.
It's really profound what
so
that
getting some sleep does put you at a different level emotionally where you're more available for something like that. Eating nutritiously, so having that be a part of your life.
Your physical health matters.
Yeah. Getting exercise. That's actually one of the few areas where they've done a study to show that it improves libido is doing some exercise.
And so does your mental health.
Yeah.
Your mental health matters. You have to be taking care of yourself. And I do, again, if you have a new baby come into the mix, you have a lot of women who get lost in that motherhood and they stop thinking about themselves. They stop taking the time for themselves, whether it is for their physical health or it's for their mental health. And it's kind of the snowball effect. Everything can start to suffer if you don't.
Yeah. And I think that's the important part of seeing somebody and talking about it is you get an opportunity to actually evaluate your overall lifestyle and what things you can work on to actually help improve your overall lifestyle, which then will have a positive impact on libido and your sexual health for sure.
Yeah, I agree. I've actually had people come to me and say, in their 60s and say, I just don't have the desire, with their partner that I used to. I just don't enjoy it as much. Like, I really want to talk about prescriptions for libido. And, I look at their chart and I say, well, your hemoglobin A17 is 7.5. You have overt, poorly treated diabetes. I feel like, some of these things might have a little bit of a trickle down effect.
Yeah. Are your vitamin D levels 3?
Yeah.
So I don't know why you don't have any energy. It's amazing.
You have severe insomnia.
Yeah.
Night shift worker.
Right. So unfortunately, there is not one pill that fixes all those things. So getting an opportunity to actually evaluate that is super important. But since we're talking about medications,
absolutely,
I do feel like that's an important conversation because there are some medical treatments out there that can help with someone who has tried all the kind of things we've talked about and would like something to help kind of boost their libido. Is there anything that you've had success with in this area.
Have at it.
Well, testosterone, the big T word, that is a medication that can help women with their libido. It's not a fix-all. It has to be part of the toolkit. But it is something that has been proven to help women who have lower testosterone improve their libido. But you can't ignore the other facets of their sexual health. You've got to pay attention to the relationship. You've got to pay attention to the physical features. Are they having pain with intercourse? So you can't just throw testosterone at someone and expect it to fix every problem. But in those women who have had maybe a higher level of desire in the past, who are not struggling with any of the other things, then yes, we might see an improvement in sexual function with giving them testosterone. There are other medications as well. Addy. That is a medication that some women will try. That's going to affect the neurotransmitters like serotonin and dopamine. It's a daily pill that they would take, but that has been proven to help with sexual function and libido in postmenopausal women.
Yeah, for hypoactive sexual desire, as well as Vyleesi, which is an injectable peptide, which is actually really effective. A lot of the problem with the Addy and the Vyleesi comes to cost.
Yeah.
They're very effective. I think initially Addy wasn't used very often because drinking alcohol was a contraindication.
Which it no longer is.
And it no longer is. Let's point that out.
Which was also a part of foreplay for a lot of people.
Yeah, because we were like, oh, good, so you can't have a glass of wine before you have sex. That's fun. Or, how much of the population drinks alcohol,
Yes.
in moderation.
Right.
So for a long time, Addy wasn't used on a regular basis, but that contraindication has been removed, and it was only there because of the lack of evidence. There were some theoretical concerns. Now there's plenty of research to support its safety in people who do occasionally consume alcohol. And there are pharmaceutical programs to help provide these medications at lower cost.
Right. And then Vyleesi is just an injection that's given 30 minutes prior.
And don't be scared of the needles. They're super tiny.
little sub-Q.
Just little somethings.
And PRP, I'll throw PRP out there. That is another one as well.
Yes.
A lot of women hear it as a yo shot. But essentially what it is, it's your own plasma. So your blood is drawn.
I was going to say, give the acronym PRP.
PRP, platelet-rich plasma.
There
yes.
it is.
Coming from yourself. It's not coming from an outside source.
Your own plasma that
not
is
taking
then
it from
put
pigs or cows or anything.
back into your body. No. And it sounds painful because it is. It isn't. I'm not saying it's painful. It sounds painful because it's an injection into the clitoris, as well as the vaginal wall where the G spot would be located. But
it's not like it's every day or every time you have sex or anything
and what
like
it's going
that.
to do is it's going to stimulate the serves to regenerate in that area, and so it can increase the sensation and it can increase orgasm. But it's actually not painful. I've done so many of these, and I'm amazed still every time I put the needle into the clitoris, and the woman does not even flinch. And I say, "Can you feel that?" And she says, "No." It is amazing. And it works well. I've had women say that their marriage was saved because it was dead down there and it was brought back to life. So that is a good option as well.
Great. And I hope people realize that, we're not suggesting any therapies. We'd always encourage you to see a healthcare provider before getting treated with any of these medications or treatment options, which, obviously we refer you back to either your doctor or we're happy to see you. But I think kind of what you talked about when you brought up kind of learning, what is causing it. I think a really important question is the why. And sometimes I get the question of, I'm having pain with intercourse.
Yeah.
Is that normal? Is that okay? Do I just keep working through it?
I think, and I think that's an important thing I was going to point out about what Tanil said too. Sometimes women are like, I don't have the desire for it. I don't have my libido is just gone. And then when you get down into the questions, you ask them and you say, well, are you having any pain with intercourse? And they're like, oh, yeah. And I'm like, well, of course you don't want sex. It hurts.
It hurts.
So there are a lot of things we can do for that depending on the cause. And for a lot of women, it's because of hormone depletion associated with peri or postmenopause, and hormone replacement therapy, which we have an entire podcast on, is really useful for that. But specifically, or in addition to hormone replacement therapy, we can add vaginal estrogen therapy. And vaginal estrogen therapy is really nice because it's so low dose and it is local. So any of the risks that are extraordinarily small in the first place that are associated with estrogen are almost completely negligible. They're not even worth. We don't even need to give progesterone with vaginal estrogen because the effects are so localized, and that can do a lot to maintain the integrity of the tissue, to maintain personal lubrication, so that any pain associated with intercourse that is associated with that hormone depletion is improved or diminished.
I would say, though, this is a good area for a woman to actually have a physical exam, though.
Absolutely.
It's not always just, let's throw some estrogen at your vagina,
Right.
because there could be something like lichen sclerosis. There can be clitoral adhesions. Like there can be something else that's going
Could
on
be a
that needs
mass
to be.
growing in
Yes,
there.
there could be it could be even just an infection. So there are a lot of reasons that they might be experiencing pain. So that should be seen by an OBGYN and assessed and evaluated and treated appropriately, because you shouldn't have pain. You should be able to have sex with your partner without pain.
Right.
Yeah, very, very true. Lichen sclerosis is actually a surprisingly common problem that requires a completely different treatment.
Right.
Yeah, I agree.
Yeah.
Yeah, and I think that's an important factor. If it's an issue, then it's really important to see a healthcare provider. So if you're having pain and that's the reason you don't want to have sex, which feels like a really good reason to not want to have sex if it's hurting, then please
your desire will be diminished.
Yeah, let's address that issue for sure. I think another one is super common that I get is, it doesn't hurt, but I'm having sex, but I can never orgasm. Like that's a problem that, every time we go through the experience, it's great for my partner, but for me, not helpful at all.
I would say that that's a problem.
Yes, it is.
And likely you might be doing something wrong, which is good because that means we can help.
Yes.
If you're doing something wrong, let's talk about it. Men and women are so different. And yes, a man is probably going to have an orgasm every time because it's easy for them. But women are different. And I think there's a lot that comes into the ability for women to have an orgasm. Part of it is physical, and so much of it is mental. I think a lot of women are worried about, what do I look like? What is he thinking? Am I doing this right?
Where are the kids?
Sounding right?
What time do we have to pick them up?
And but for a woman to have an orgasm, would you not agree that you have got to be selfish? Like you have to not worry about
let
him.
Go and just have a good time.
You focus on you. You focus on what you're feeling. You communicate your needs, and realize also that a lot of women don't actually orgasm with just vaginal stimulation. That a lot of women require some degree of clitoral stimulation, and that's going to vary. It's going to vary in the intensity. It's going to vary in the duration. We're not a one size fits all. Again, we're not all going to fit in that box. But learning your body, taking that time to explore your body, to talk with your partner, to have those open conversations, say, this feels good, don't really like that so much, will allow you to get there.
Yeah, I like the focus on external stimulation as well, maybe in conjunction with internal stimulation. And
don't be afraid.
To use the use of vibrators. I have patients that come to me that say, my sex life is pretty good, but do you have any ways it could be more fun? And
that's allowed.
We're always, and there are actually, and which, there are compound prescriptions that can enhance clitoral sensitivity, and that can be good for women who struggle to achieve orgasm and for women who just want to have fun. Listen, there is nothing wrong with a sex life that is just fine. And you're like, I don't know, let's do something else.
Good for you. Good for him.
Yeah. I have a lot of patients that ask me that, and they're like, is that weird? I'm like, absolutely not.
Yeah, and I think, speaking from a guy's perspective, they want the experience to be good for their partner. Like,
yes,
we want it to be good for both sides. So that's more enjoyable for us.
So there's a reasonable amount of evidence-based literature too on different types of stimulation, different position changes. I think a lot of people really struggle to be creative with positions
Yes.
or to have the guts to try something new. And then the stimulation creams that are prescribed as well can be really useful. And then relaxation techniques.
Yes.
I do think what you said about being able to relax and let go plays a huge factor in
Be
women's
in the
sexuality and achieving a desired result. To be in the moment, there are stress relief meditation practices, lots of different things that actually have pretty good neurological evidence to support them.
And I think a lot of it too boils down to communication.
Mm-hmm.
Like, these are not easy conversations to have with your partner, especially because, like you were saying, starting out, you get married or you start a relationship and it's so exciting and
Right.
it's so much
everything
easier.
is
Yes.
easy.
But then, as life settles and things change, it's important to be able to communicate what you're feeling and what you need.
Yeah, as life settles and changes and your body changes, and you have 3 to 5 kids and you look in the mirror and things are a little bit different.
Yeah, I mean, I recommend a lot of my patients 90% foreplay, 10% penetration. And I think it's just very common for women to struggle having an orgasm during penetration. That's a pretty common problem. So being willing to communicate, hey, this feels good. Keep doing that. That feels really good. And if you are climaxing not during penetration, that's okay. Like, I think you find what is working for you, whether it's the use of a vibrator or whether it's just stimulation manually. I think there's ways to explore your body with your partner that can be kind of fun and exciting. And if you're willing to do it, can actually help improve your sexual experience
Satisfaction.
dramatically. Yeah, it really does make a difference.
Agreed.
I mean, I think communication is important, and I think a common issue is I have patients who ask, "Hey, I grew up in a very strict religious background where sex was not really talked about, and I feel like it maybe has impacted how I feel about sex, or doesn't feel like it's right, or I shouldn't enjoy it, or there's some shame, maybe some religious or societal shame around the experience of sex."
When I have a woman ask me that question,
Mm-hmm.
I think it's important to let her know that the thoughts and the ideas that have led her to feel shame around sexual function, sexual desire,
Or even sexual pleasure,
or even sexual
I can't
pleasure.
enjoy this,
Yes.
or
I
it's
think
wrong.
pleasure's the big thing.
They've come from somewhere. Likely parents, family members, cultural relationships, society. They've come from somewhere, but they're not necessarily hers. And so it's important for her to recognize that, yes, these are thoughts, but as an adult, you're able to think about these thoughts and ideas and ask yourself, okay, is this serving me? Is this helping me in my relationship with my partner and my sexual desires? And if it's not, then recognize it as someone else's thought and idea. Be proactive at breaking that cycle of stereotyping these thoughts and ideas and form your own. And then down the road, it likely is going to pop in your head again. And guess what? You realize that's what brains do. They remember thoughts and ideas, but again, it doesn't make it your thought. And so if it doesn't feel like something that you agree with that is serving you, then you let it go and you continue down this path that's going to improve your sexual health.
Yeah.
Yeah, and I like that, the retraining the thought process for a lot of women, and I think it's what I run into clinically is what you said, this shame over experiencing pleasure. I don't run into a lot of shame over sex generally, because it's something we're supposed to do for our partner. It's something but the shame over enjoyment and pleasure is something that's pretty profound that I run into. And I do think for a lot of women, it requires a certain amount of therapy. Cognitive behavioral therapy or other modalities that are really useful in helping somebody retrain that thought process and come to accept sexual health as something that's important for them and something that is an important part of the way that they view themselves and the way that they experience life. And that's that for some women, to some degree, that can be something that requires a kind of a lot of
Yeah.
of work.
Yeah, and I unfortunately feel like sometimes some of that shame can be around abuse or something that's happened in their past. So when I hear things around feeling shame around sexual function, I really do think it's important to have a conversation about maybe seeing a mental health professional, which we are hoping to offer at our clinic as well.
Yeah.
And so it is something that unfortunately isn't as easy sometimes as saying, don't think that way. Like, I think it does sometimes take a little bit of work
It takes effort.
and
It
effort
does.
to kind of to get past that society or religious or however kind of shame you want to look at it. And I mean, everyone has their personal views on religion. I really don't feel like there are religions out there that are really intentionally trying to tell you, at least that I have been associated with, that are really trying to tell you can't have enjoyment with this part
it's
of
not
your
part
life.
of a lot of core doctrines.
Yeah,
It becomes a cultural thing.
Yeah, I think it's more cultural or perception based, and that's something that I think can be worked on. So I think another good question is, how many times having sex is normal? Like, how many times a week, or how often would you say is a normal amount of wanting to be sexually intimate with your partner?
Is there a box? We're going to try and fit someone in the box?
Yeah, we're going to try to fit somebody in that box. The one we decided not to put people in.
Yes.
That one.
I don't think there's a box for this either.
Nope.
There's not a one size fits all.
There's not.
Yeah, I think it's really I think it's very common for media and for our social groups to portray the amount of sex that's happening in a relationship or in a home as far greater than the average. I think when all the guys get together or all the gals get together and they're talking about, how much sex they're having, it's grossly misrepresented. Because I know how much sex is actually happening in that home because I talked to them about it in a clinical setting.
Fair enough.
So, it comes down to, it becomes a problem when your expectations for each other are not being met. And for some people, that's, they feel fine with having sex once a month. And for some people, they feel fine having sex once a week. And it becomes a problem when it becomes a source of conflict in your relationship, or when you feel like your needs aren't being met.
I think it is a challenge for a lot of women because there is a different level of expectation between men and women, I believe. Correct me if I'm wrong.
It's rare. There are a few times when I've had patients say, hey, my partner never wants to have sex with me. And that's usually the rare
Less
case.
common than the other way around.
Yes. It's most often the other way.
This question, it requires a longer discussion again about all the things we've already talked about. Are there reasons that maybe you are not wanting it as much as your partner? Because that tends to be the most common situation. And so, yes, again, pain, relationship, we talk about all of those things. But if everything's fine and you're not lining up, sometimes it can be an easy fix, where you kind of help a woman realize that, or remember how important it is in their relationship, and recognize that he walks in the room with that look in his eye. You can spend 5 minutes and connect and feel that sense of like reward because you had that time with your spouse, because it really doesn't take longer than 5 minutes sometimes. You can do that, and you're not going to regret it. If you're not having pain and your relationship is good, you're not going to regret it. And hopefully you're going to leave with this boost of serotonin and dopamine that's going to leave you feeling better. Or you can spend a half an hour trying to reassure them that you do love them and you are attracted to them, but you just don't feel like it.
Yeah. And of course, all of this bars other complications like, abuse or neglect or, substance abuse, and
100%.
that are, which we try to address too. If
they're part of
you're
the
worried
conversation
about,
that you have to have.
it always has to be a part of that conversation. But generally speaking, we all have to give, we all take. in a relationship. And if you feel like it's a problem in your relationship, then it's a problem.
Right.
And if you feel like, well, actually, I feel fine and my partner hasn't complained, but I'm hearing all of this. And I think, no, ignore all of that. If you guys feel fine, it's fine. There is no definition of what is normal. What is normal is what satisfies you both.
Exactly.
Yeah. And I think usually that question comes from a mismatch between your partner and you, and trying to find a common ground where that is a healthy place, I think is something that takes work and communication with your partner. I mean, we talk about sex a lot because it's a very personal feeling and it's very individualized to relationships. And I mean, relationships in general require a lot of that give and take, where it's, who did the dishes, who's cooking, who's helping take the kids to this, or who's gonna,
Yeah.
do, like, there's a lot of
Well, I
parts.
don't care if I leave my socks on the floor.
Yeah, I mean, there's a lot of parts of a relationship that involve that communication. This one just has a lot of emotion, and it just sometimes feels like it affects things at a higher level just because of the emotion involved. And that's where communication becomes super important.
So important.
And being able to find a way to work together. And it may involve doing some work and making it, hopefully, number one, enjoyable, so that's a good experience, or planning it when things are busy, or finding a way to just be at a place where you're comfortable together, because it is so different for every couple. And it is just not something that I feel like you should say, the number is this
There's
many
not a
times.
box.
Yeah, there just isn't.
My girlfriend says they have sex 3 times a week.
Right. Bottom line is, it's a good conversation, and it's a great, healthy conversation to have with a healthcare provider. It's a super healthy conversation to have with your partner. And in the end, it sometimes involves getting some outside help.
And I love when partners come with my patient to their visits and we can have a really good conversation together. There is nothing wrong with going to see your partner's gynecologist and being present for the conversation if that's something that's going to help you communicate and open up the channels of
I
communication.
especially like it when people are not sexually active yet. In our culture, there are a lot of people who don't start becoming sexually active until they get married. And so if they are willing to come to that appointment before they get married, I feel like it's super helpful to help give them some guidance together on what things they can work out together and help that be a better experience.
We do practice in a unique setting.
I do practice in a very unique setting. But yeah, that's helpful when the partner's willing to come and be a part of that conversation. I think kind of the last question just would be, if I'm struggling and I want more resources, what's a good resource that you've had some success with to help give more information?
Fire away, Jen.
Yeah, I refer people to the book "Come as You Are" very, very frequently.
Really good book.
The Science of Sexual Desire.
Mm-hmm.
Really good resource for couples of all ages to understand their sexuality and their desire, and how they can take somebody with a really high desire and somebody with a lower or average desire, and they can mix those together and find ways to make that work. And I actually like the Rosie app, ROSY. It was developed by a urogynecologist and OBGYN. It's very evidence-based, but there are resources on there for women who experience a lot of different issues, and you can kind of browse and cater your search according to what your specific needs are, whether it's desire, whether it's pain, whether it's chronic illness, whether, there's a lot of different resources on there, and it's pretty evidence-based.
And then I would say, don't be afraid to talk to your healthcare provider.
Yeah.
We're here.
Yeah.
And we're happy to help. And
nothing gets better if you're not willing to talk about it or address it. It doesn't magically go away.
And when that partner's there, we can be the ones that bring up the really uncomfortable stuff to dip your toe in the...
Yeah, I really like Come As You Are as well. I think it does a good job doing kind of both talking about the emotional, mental aspect, and also does a good job of talking about some physical techniques you can use to help make the experience better for both partners, which is really helpful, because I think sometimes we say, oh, communicate with your partner, and then I don't know what it's supposed to say.
What questions do I even ask?
Yeah,
where do we even start?
What do I say? Do I say good, bad? So I think
having a set of questions that can kind of guide that conversation is helpful.
Really helpful. So yeah. So hopefully this has been a helpful discussion. We would be excited to be willing to see you in a clinical setting. Valley Hormone and Wellness Clinic. And we look forward to talking again about some other topics that hopefully are interesting to others and that maybe we can
That
answer some
will be
questions
interesting.
that will be interesting. Yeah, we've got some really fun stuff coming up. We want to talk about peptides. We're going to talk about wellness in the sense of nutrition. We're going to talk about exercise. So, some other things that we feel really passionate about that we feel like can have a really strong impact on the quality of life.